Bismillahirrahmanirrahim. Quote of the day is set goals to achieve your dream. Assalamualaikum everyone. I am Dr. Shajeea Javed, PGR Community Medicine, and I am going to present the topic of SWOT analysis of surveillance system in Pakistan under supervision of Professor Dr. Saira Afzal. Learning outlines. In today's session, we will cover a brief introduction to surveillance system. We will see the surveillance systems which are working in Pakistan. What is SWOT analysis? SWOT analysis of a surveillance system. Recent updates, and at the end, there will be MCQs. Learning outcomes. By the end of this session, participants will be able to understand and explain surveillance systems, their importance in public health, SWOT analysis, and analysis of the Pakistan surveillance system along with recent updates. Surveillance in public health. Surveillance in public health refers to the systematic collection, analysis, and interpretation and dissemination of health-related data to monitor and control diseases and other health-related issues. It is essential for planning, implementing, and evaluating the public health practices. The primary goal of the public health surveillance is to monitor the health status of a population, detect disease outbreak, track long-term trends, and inform public health policies and actions. The basic elements of a surveillance system include an event which is occurring, and this event is being reported by the healthcare system to the public health authority. The data is collected, it is interpreted and analyzed, and the information is generated, which will lead to some decision making and intervention would be done, and this will ultimately would be some expected changes in that event. Types of surveillance. There are the following types of surveillance. Passive surveillance. Healthcare provider, laboratories, or institution report cases of disease to the public health authorities. It is less resource intensive, but many cases undergo underreported. Active surveillance. In active surveillance, public health officials actively seek out cases by contacting the healthcare providers and reviewing their medical records. This method is more accurate but resource demanding. In sentinel surveillance, a selected network of the healthcare facility or laboratory is tasked with reporting on specific disease. It provides data on trends without full-scale population coverage. Syndromic surveillance. In this surveillance, the approach focuses on identifying patterns and symptoms before a disease is confirmed. It is useful in detecting outbreaks early, such as flu or bioterrorism events. The surveillance systems in Pakistan. Pakistan has a structured surveillance system in place, which is led by the Ministry of the National Health Service, Regulation and Coordination, in collaboration with various international organizations like WHO, Gavi, and CDC. One of the key initiatives is Integrated Disease Surveillance and Response System, which aims to strengthen the surveillance of the infectious diseases across the country. The key features of Pakistan's surveillance system. Integrated Disease Surveillance and Response, IDSR. IDSR is designed to integrate data collection and response mechanism for various diseases rather than focusing on a single condition, ensuring a comprehensive monitoring of public health threats, while doing the efforts that are coordinated at local and provincial level and national level. It promotes active surveillance and rapid reporting of the disease outbreaks and epidemics, which help in quicker decision making. Lady Health Worker Program. The Lady Health Worker Program is an important community-based surveillance initiative where the trained female health workers visit homes to provide the basic healthcare services and report on the health issues at the local level. Lady health workers act as a bridge between communities and the formal health system, identifying the health problems, monitoring disease outbreaks, and ensuring timely interventions. Polio surveillance system. Polio surveillance is a major focus of Pakistan as the country continues to combat polio throughout extensive eradication campaigns. The acute flaccid paralysis surveillance system is very critical in identifying the cases of polio in children under the age of 15. The system ensures thorough tracking and reporting of potential polio cases, allowing the health authorities to immediately respond with vaccination campaigns and other interventions. Health Information Management System. Health information technology is increasingly being utilized to gather and process the health data. Focus on the key diseases. The system also places emphasis on communicable diseases other than polio like TB, malaria, and more recently COVID-19 through expanded program on immunization API, National Tuberculosis Control Program NTP, and COVID-19 surveillance. Now we'll see what is SWOT analysis. SWOT basically stands for S for strength, W for weakness, O for opportunities, and T for threats. SWOT analysis of SWOT metrics is a strategic planning and strategic management technique which is used to help a person or organization identify the strength, weakness, opportunities, and threats which are related to business combination or project planning. It is sometimes called situational assessment or situation analysis. In SWOT, the S stands for strength, which is internal factors that give an advantage or edge over others. These are the positive attributes of the system that are within its control. For example, strong partnership or effective data collection. The W stands for weakness, which are internal factors that hinder the progress or create disadvantages. These are the areas where the system or organization has limitation, such as insufficient resources or gaps in infrastructure. The O is for opportunities, which they are the external factors that the system or organization can capitalize on to improve or expand its capabilities. These are the positive external conditions like new technology, partnership, or emerging markets. T is for threats. They are the external factors that could cause problems or risks. They are the challenges that may negatively impact the system, such as political instability, natural disaster, or the economic downturns. Uses of SWOT analysis. SWOT analysis is used for strategic planning, decision making, identifying the opportunities, for risk management, for competitive analysis, resource allocation, project planning, personal development, performance evaluation, and for good communication. Rules for a good SWOT analysis. A SWOT analysis should be specific, realistic, it should be actionable, it should prioritize the issue and focus on internal versus external factors. It should involve diverse perspective and use data and evidences. Now we will do the SWOT analysis of Pakistan surveillance systems. The strength of the surveillance systems are established disease surveillance network. Pakistan has developed several disease-specific surveillance programs like polio surveillance, national TB control program, HIV/AIDS surveillance system, which provide real-time data for specific health challenges. Government and international support. Strong collaboration with the international organizations like WHO and CDC support capacity building and technological upgrades. Technology utilization, increasing use of digital tools such as mobile application, electronic reporting system, and geographic information system technologies help in real-time data collection, reporting, and mapping outbreaks. Community health worker networks, the presence of the lady health worker and other community health workers support the surveillance of disease in the rural and underdeveloped areas, facilitating the access to the timely data from the remote regions. Emergency Operations Center (EOCs). EOCs have been established in response to the health crisis like COVID-19 pandemic or dengue outbreak, demonstrating the ability of the systems. The weakness of the surveillance system is fragmented data systems. Lack of an integrated, unified national surveillance system lead to fragmentation where different diseases are monitored separately, making it difficult to consolidate the information for comprehensive analysis and timely response. Underreporting and incomplete data. Due to the low healthcare access in some regions and inconsistent reporting practices, underreporting of cases, especially in the rural and conflict-affected area, remain a significant challenge. Limited trained personnel. There is a shortage of skilled epidemiologists, data analysts, and the public health professionals which are trained in surveillance, limiting the system's capacity to manage and interpret the data effectively. Weak infrastructure in the remote areas. Inadequate infrastructure like electricity, interconnectivity, and healthcare facilities in remote and the tribal region make it very difficult to collect data timely and accurate health data. Bureaucratic challenges, delay in decision making, resource allocation, and the lack of the coordination between different health agencies and provincial governments can hinder the effectiveness of a surveillance system. The opportunities. Integration of the surveillance system, integrating various disease-specific surveillance systems into comprehensive national framework would enhance data sharing, streamline the operations, and improve the response time. Adoption of the advanced technology, expanding the use of the artificial intelligence AI, big data analytics, and predictive modeling tools could improve the early detection of the outbreaks and strengthen overall preparedness. Public-private partnership, collaborating with the private sector entities, including the tech companies and healthcare providers, could provide additional resources, technology, and innovation to enhance the system's capabilities. Increase international support, expanding collaboration with the international organization could lead to better training programs, funding opportunities, and the sharing of the global best practices. Strengthening provincial coordination, greater coordination between the provincial and the federal health department, especially in the context of the devolution, can enhance data accuracy and timeliness. Threats, political instability and conflict. Ongoing conflict and political instability, especially in the border areas and the region affected by the insurgency, pose challenges to maintaining effective surveillance. Health system underfunding. Chronic underfunding of the health system limits the resources which are available to enhance the surveillance infrastructure, personnel, and technologies. Data security and the privacy concerns. As digital surveillance expands, concern over data privacy, cyber attacks, and the misuse of the personal health information are becoming significant threats that may undermine the trust in the system. Emerging diseases and antimicrobial resistance, emerging infectious diseases like zoonotic disease and the rise of the antimicrobial resistance present new challenges for the surveillance system, potentially overwhelming the existing capacities. Cultural and social barriers, cultural belief, mistrust of the government system, and the lack of the public awareness can hinder participation in disease reporting and surveillance efforts, especially in the rural and conservative areas. This is again the brief of the SWOT analysis of the Pakistan surveillance system, showing strengths like vertical program like polio have their own surveillance mechanism. Syndromic surveillance is also present. Electronic reporting is starting in all the provinces. Field epidemiological training programs in IH is well established for the country now. The weaknesses are there's no legal framework for surveillance, the lack of the enough public health labs, vertical programs are not integrated into the national surveillance program, private sector is not included in the surveillance reporting network, the One Health approach is not comprehensive. The opportunities are provincial disease surveillance and response units are being established. Public health labs are being opened. There's a potential in capitalizing on the infrastructure of organizations such as Pakistan Medical Research Council. Policy unit and streamlining of the surveillance activity represent positive steps in relation to fostering greater emphasis on the use of the evidence policy. The threats are less resource allocation, financial and technical. There is deficient national policy on the public health surveillance. Utilization of the surveillance report by the decision maker is limited. Deficiency of a legal system that mandates the notification of the priority disease and regulates laboratory practices. Recent updates. An article recently published assesses the infectious disease surveillance system in Pakistan, the challenges and the way forward. Infectious disease surveillance in a community is essential to prevent, control, and detect outbreak. A strong surveillance system is a need of time for low to middle income countries like Pakistan, where around half of the deaths reported are due to the infections that can be easily prevented in the presence of a surveillance system. Although Pakistan has IDS which monitors and collects the data on several infectious diseases, the system is still unreliable, inadequate, and substandard. Numerous factors are hindering the development of an integrated disease surveillance system in Pakistan. The major issue in building an effective surveillance system is limitation of the financial and logistic resources. The country's environment and terrain render it very difficult to provide surveillance tools, communication devices, and vehicles and office supplies in all the districts, especially in the remote area. The financial constraint can be judged by the fact that in 2019, Pakistan allocated only 1% of the GDP to the health sector, contrary to the WHO adopted resolution of allocating a minimum of 5% in developing countries. Other reasons are non-recognition, the lack of the budget allotment, and the workload, along with the limited trained staff. So, a highly competitive team, robust logistic, and financial support and in-depth research are required to identify the already existing loophole and to devise and implement a new strategic plan. The country is in a dire need of an effective, active, and passive surveillance system. A report published by WHO states that Pakistan is the first country to take steps towards early implementation of the antimicrobial resistance surveillance system in the region. At the request of the government, a WHO technical mission visited Pakistan from 23rd to 28th November in 2015 in order to map the capacities for early implementation of the national antimicrobial resistance surveillance. The mission comprised of epidemiologists, laboratory scientists, national counterparts that conducted visits to the various hospitals and labs in Karachi, Lahore, and visited National Institute in Islamabad. Pakistan has already appointed a national antimicrobial resistance focal point. Antimicrobial resistance pose a major challenge to the health sector in all the countries. As a part of response to this global problem, a global action plan on antimicrobial resistance was endorsed by the World Health Assembly in May 2015. One of the objectives of the global plan for the country is to strengthen the knowledge and evidence base, which include monitoring resistance to the establishment of the National Antimicrobial Resistance Surveillance Program, and WHO will continue to support its effort to implement and expand its antimicrobial surveillance system in Pakistan. This shows the country eagerness to improve their surveillance system. National Genomic Surveillance Strategy for Priority Disease and Pathogen, Islamic Republic of Pakistan recently published a report, was recently published in 2023 Feb by National Institute of the Health and Ministry of the National Health Service Regulation and Coordination Government of Pakistan. This showed the SWOT analysis of the broader surveillance architecture, showing the strength of the system by NCOCs and EOC platforms, One Health platform, WHO supports surveillance activity, nationwide network of the vertical program like malaria, TB, and HIV, and there is networking with the international labs or institutes. The weakness of the systems are lack of the coordination, limited integration of the surveillance data, lack of the coordination between human, animal, and environmental sectors, and limited infrastructure and internet access in the remote areas. The opportunities are connecting data between the existing surveillance system, Knowledge and experience gained during COVID-19 pandemic can be used to develop strategies or genomic surveillance for other priority diseases, engaging existing healthcare commission at provincial level. The threats are sustainability of resources, conflict of interest among the stakeholders, and transfer poaching of the trained workforce. Similarly, an article published in 2024 assessed the impact of the integrated disease surveillance and response system on surveillance management in healthcare facilities in Pakistan. Disease surveillance is very crucial, especially in highly vulnerable setting like Pakistan, to assess the impact of integrated disease surveillance and response system (IDSRs) implemented by the provincial government to strengthen the infectious disease surveillance and reporting in 6 districts of Pakistan in 2016. As a low and the middle income country, Pakistan has to deal with a double burden of the communicable and non-communicable diseases. Therefore, the surveillance, detection, and response for both the group of disease need to be agile. Without a sensitive surveillance and reporting system, timely action cannot be initiated to address disease occurrence, and without a timely coordinated response, disease control and prevention measure cannot be effective. The Integrated Disease Surveillance and Response System is a WHO strategy for improving epidemiological surveillance and response. It coordinates and integrates surveillance activities by improving the integration of surveillance, laboratory, and response function of the provincial disease surveillance system. It is concluded that IDSRS is a valuable addition to the healthcare data management system. District-level response monitoring may furtherly improve SORS, as may the optimization of resource allocation and provision with more empowerment of the local workforce. Now, MCQs. MCQs 1 is, you are a part of a team which is tasked with improving the surveillance infrastructure in remote and the tribal region. Which weakness you should address first? A, low population. B, bureaucratic challenge. C, fragment data system. D, weak infrastructure like electricity, internet in remote area. And E, insufficient funding of vaccination programs.
E.
D is the correct answer, weak infrastructure. Second, a new epidemic is spreading and Pakistan's surveillance system needs to respond quickly. What trend would enable a rapid response? A, emergency operation centers. B, provincial health coordination. C, fragmented data system. D, international funding. E, weak infrastructure in the rural areas. A is the right answer. A is the right answer. Pakistan faced multiple challenges due to the government instability in sub-region, which threat could further undermine the surveillance system. A, data privacy concern. B, fragmentation of the system. C, political instability and conflict. D, weak public awareness. E, cultural barriers. C is the right option, political instability and conflict. During an investigation of a disease outbreak in a remote village, you realize that real-time data collection is difficult. Which weakness of the surveillance system does this reflect? A, lack of the government support. B, bureaucratic delay. C, weak infrastructure in remote areas. D, insufficient international collaboration. E, underfunding of the urban health facilities.
C.
Yes, C is the right option. Question 5 is, a shortage of epidemiologists is limiting a country's ability to manage and interpret health data. What is the primary weakness affecting surveillance effectiveness of this country? A, fragmented data. B, limited trained personnel. C, bureaucratic challenges. D, cultural barriers to the data collection. Or E, insufficient use of the mobile applications.
B. A, fragmented data.
No, the B, limited trained personnel is the right option. 6. Your team is implementing a digital reporting system for the country's health data. What threat must be carefully managed to ensure the trust in a new system? A, underreporting of cases. B, data security and the privacy concerns. C, limited government funding. D, lack of the trained personnel. And E, political instability.
B.
B, data security and privacy concern is the right option. 7. The integration of the disease-specific surveillance system into unified national framework has been suggested. Which opportunity would this provide for Pakistan's surveillance system? A, faster allocation of resources. B, enhanced data sharing and streamlining of operation. C, increased control over international collaboration. D, reduction in international dependency. And E, expansion of the provincial government rules.
B.
B.
B, increase in enhanced data sharing and streamlining of the operation is the correct answer. Number 8. While implementing a new health surveillance project, you find that several local systems operate independently without sharing the data. This weakness is most likely causing an inefficiency in the surveillance system. A, poor funding for the health project. B, inconsistent reporting system. C, fragmented data. D, political instability. Or E, lack of the government support.
C.
Yes, C, fragmented data system is the right option. Number 9. During the COVID-19 pandemic, several health programs in Pakistan faced delay due to overlapping role between the federal and the provincial authorities. What weakness of the system does this reflect? A, lack of international partnership. B, bureaucratic challenge. C, over-reliance on the technology. D, underreporting of the cases in the cities. And E, strong political support.
B.
Yes, the B, bureaucratic challenge is the right answer. Number 10. Pakistan is looking to further develop its partnership with international organizations like WHO to strengthen disease surveillance system. Which opportunity does this scenario highlight? A, increased funding from the local government. B, expanding international support and collaboration. C, reducing provincial health coordination. D, minimizing technological dependency. And E, strengthening political ties in the rural areas.
B. B.
Yes, B, expanding international support and collaboration is the right answer. This is the key to the MCQs. The link to YouTube channel with all the videos will be shared. Thank you.
Thank you very much, Dr. Shajeea. This is the best presentation that I have heard in this week. So I'm so glad that you have presented it so well. It is a very difficult topic to encompass all the important aspects of surveillance, SWOT analysis, as well as what are the different important diseases that need surveillance, WHO teams and how they are working for antimicrobial resistance. You have also covered beautifully about the NIH and the different aspects that are being done through collaborative partnerships. So very well done. And I'm so glad that you have worked very hard on this presentation.
Thank you.
I would like you to please write a opinion or perspective about the surveillance in Pakistan, encompassing all the important points that you have presented today. I would discuss it tomorrow, inshallah. Thank you very much once again, Dr. Shajeea. I can see the spark in you, the brightness, and the intelligence. So keep it up.
Thank
Allah
you so much,
Hafiz.
ma'am. Allah Hafiz.